So right now Dr. Mandel is reviewing Angel's chart and going over all the information that Dr. Catanzaro gathered during the testing, and he'll be going over all of that information with Angel during the consultation.
Hello.
Hi.
How are you?
Good, how are you?
Good. Good. I'm just looking at your maps here, which are good. It shows that you have really good corneal thickness and just the right amount of curvature, and that you don't have any underlying corneal conditions such as the ones I went over in the video, like keratoconus or any unusual thinning or an unusual shape or configuration to your cornea. So your maps are good and your thickness is good.
Mm-hmm.
Your amount of nearsightedness is perfect. It's not too much, it's not too little. You don't have any significant astigmatism. That's really good. Most importantly, your eye is not dry. As we check for that, that's super important. And I know we saw you last year and everything is stable, so the stable refraction is really important. Everything looks really good.
Great.
Let's take a look. You can take your glasses off. Excellent. Is that comfortable?
Yes.
I know, it's really bright, I know. That's good. Perfect. Cornea looks really good. Again, no dry spots. Your eyelids and lashes, everything looks good. And I know Dr. Catanzaro got a good look at your retina and everything looks good there. Most importantly, everything looks great. What questions can I answer?
What kind of LASIK surgery do you think I'm a good candidate
Right.
for?
So we pretty much only do what we call the all laser LASIK now.
Mm-hmm.
So that means that we use one laser called the femtosecond laser, which makes the flap, and then the other laser does the wavefront shaping.
Mm-hmm.
So it's called all laser LASIK because no blades touch your eye or anything like that. So the flap is made with one laser,
Mm-hmm.
and then the shaping is done with the other laser, and that's just called all laser LASIK. That's the best. That's pretty much only what we do now.
Okay.
Yeah.
What kind of results can I expect?
Well, given you're perfect, you're such a perfect candidate with your refraction, which is just about a -4.
Mm-hmm.
You have about a 99% chance of getting 20/20 or possibly better.
Oh, wow.
And the nice thing is, if you're a little bit off,
Mm-hmm.
we can always do a touch-up. There's no extra charge for the touch-up or
Okay.
anything like that. But the chance of you needing a touch-up with your prescription is less than 1%.
Okay.
Yeah.
That's
So
awesome.
that's good. Yeah, it's good.
Is there anything that I need to do to prepare for surgery?
So beforehand, and Helen will go over that with you, what we want to do, again, because we're totally focused on safety, making sure that there's no infection and lowering the chance of infection, inflammation, and dry eye and everything.
Mm-hmm.
We'll have you use some eyelid scrubs for a week beforehand to make
Okay.
sure that there's no oils or any kind of material on your eyelashes. And then for a few days before your surgery, we'll have you use some antibiotics to help prevent possibility of infection.
Okay. Okay.
Yeah.
I think that's all my
That's
questions.
good. Yeah, no, you're a perfect candidate. You should do really well.
I'm excited.
Good. Yeah, it's exciting.
It really
it's
is.
exciting. I know. All right, well, I'll have Helen come in and she'll go over all the details, the logistics of, timing and cost and all that kind of stuff.
Okay.
And we'll see you soon.
Thank you.
And here's the other thing. If you can think of any other questions, if something comes up you forget to ask, just mark it down. Give me a call. We're always
Okay.
available.
Will do.
Okay,
Thank you.
thank you.
Bye, Dr. Mandel.
So you might have one question. Why is Dr. Mandel wearing glasses? Well, let's explain
he's an
that.
old guy. No, actually, I'm fortunate that I don't need glasses for the distance for driving or anything like that. But I do need them for reading. So I wear glasses around a chain. Because I want to really look like a librarian, basically. And that's what I do.
That works.
There you go.
All right. Thank you, Dr. Mandel.
Thank you.
Okay, Angel. So basically, as you heard, you are already a candidate for all laser LASIK.
Yay.
And we are just about 3 to 4 weeks out in our booking. We have the centers here in Castro Valley, San Jose on Fridays, and where you work, so you know the commute problem there.
Yes.
And also Wednesday in Concord. So you are able to utilize whatever center you want to use, and then you'll be seeing us the next day, close to whatever center you choose for your first day post-op. We'll follow you for 1 year after that, and that is part of your global fee. So it includes as many times as you want to see us and as many times as Dr. Mandel would like to see you. So that'll be for a full year. Other than that, when you do hold your surgery date, we'll be sending you your surgery packet about 2 weeks ahead of time. It's going to arrive 2 weeks ahead of time, so you have a full week to read over everything and call us if you have any questions. We have a number 877-210-2020 extension 3 that we have inside your folder that's a hotline. We have a whole refractive department, including a doctor, available for you to call Monday through Friday, 9 to 5. So any questions you need, any scheduling, anything, we always want someone there and available for you. And of course, as Dr. Mandel mentioned, he's always available for you as well. So when you open the packet, read over everything, call us if you have any questions. It's going to go over everything that you need to do beforehand. There's some lid scrubs that you'll be doing, and there'll be some prescriptions for you to turn in. You just turn into your medical, wherever you go for your regular prescriptions, and you'll just pay your copays.
Awesome.
And then from there, you'll just get information on when to stop wearing makeup. It's 7 days total, 3 days before. I know.
No.
I know. It's always hard. The day of surgery and 3 days after.
Okay.
But you will be shocked how much extra time you have in the morning when we don't have to put any makeup on. And then you'll have no contacts for 3 days before the surgery as well, so you'll be back in the glasses. And then when you come in on the day of surgery, you'll bring a driver. You're here with us for about 2.5 hours. You're with Dr. Mandel about 20 minutes. But the whole experience from beginning to end, the signing in, the surgery, the post-op care, about a couple hours. You're going to leave here with your driver, and you'll have see-through shields on that you're going to keep on to the next day. Your job that evening is just to keep your eyes closed. You will open your eyes to walk to the bathroom and back, or open your eyes when whoever is with you comes to give you your meal. We let you open your eyes to eat the meal. Not watch TV and eat the meal, but just eat the meal. Other than that, there is a little bit of tearing and a little burning sensation sometimes with the surgery. Get a good nap in. Most of that goes away in a few hours, and you're just mainly bored. And so you can get an audiobook or a podcast or whatever you want to do to entertain yourself with your eyes closed. Next day, you'll get up, you'll remove those shields, and you'll come and see us for your first day post-op. You'll start all your medications. Again, that's all outlined in your surgery packet. And it'll also include your post-op restrictions, which are minimal. Again, no makeup for 3 days after surgery, but also things like exercising. We don't want you to be straining your face like you would do if you're really getting into an intense workout. You know, you always put facial expressions when you start to like really lift weight or get heavy in exercise. So we don't want any of that to be happening for the first 2 weeks. Also, we don't want you to be in water, such as pools and hot tubs, for 2 weeks. And then oceans, rivers, and lakes, things that don't have any kind of quality for sterile environment, for about a month. And at this time of year, that's probably the only restrictions. And no gardening for 2 weeks. But again, all this is outlined in your surgery packet as well. So read over everything, call us if you have any questions, and we can walk you through the whole procedure.
Okay, great.
Do you have any further questions?
When can I make my appointment?
All right. Well, luckily we have Tracy ready for you here at the computer, and we'll get some dates ready for you, and you pick the center, and we'll go forward from there.
Perfect.
All right. Thank you for letting us go Facebook Live with you today. We really appreciate it.
Oh, yeah.
When we pick the surgery date, we will let you know, because Angel is actually allowing us to do her surgery Facebook Live as well. So you'll see her through the whole experience. We'll see you soon, Angel.
See you soon.